while there's 1 in 3 women that will suffer from heart disease, it is 80% preventable.
Hello and welcome back to episode 182 of Redefining Midlife. I'm your host, Jo Clark, and today on the podcast, I have a world-leading expert, researcher, and advocate on women's cardiovascular health. Now, this is an episode that I have wanted to make for a very, very long time because the topic affects every single woman who is listening now. Here's why. Did you know that 90% of women will have at least one risk factor for heart disease? That's 90%. It's a high chance it could be you or many of the people that you know, your sisters, your friends, neighbours or colleagues. And yet 80% of premature heart disease is actually preventable. So I want you to do something when you finish listening to our conversation today. Share this episode. Send it to your sister, to your mother, to your friends, to your daughters. This is a kind of conversation that could genuinely save a life, and I don't say that lightly. Now, my guest today has dedicated her career to making sure that women know what's at stake when it comes to their hearts. Professor Linda Worrall-Carter is a founder, director, and CEO of Her Heart, Australia's peak body for cardiovascular disease in women. And she is one of the most important voices in this space, not just in Australia, but globally. Now, with over 25 years in health and 15 years focused specifically on women and cardiovascular disease, she has secured more than $12 million in research funding. She's authored over 100 publications and 160 conference papers and founded 3 research centres. She has also been recognised as Telstra Businesswoman of the Year in the Social Enterprise category, received the National Female Entrepreneur Award, and is a passionate advocate for closing the very real gap that exists between how heart disease is understood, diagnosed and treated in women compared to men. Our Professor Worrall-Carter is a researcher, a clinician and an entrepreneur. She's also an activist, and honestly, she is someone that every single woman needs to hear from. So after that lengthy intro, Professor Linda Worrall-Carter, welcome to Redefining Midlife.
Thank you, Jo. That was a very generous introduction.
And
I've been looking forward to speaking with you.
Awesome.
Really excited to be able to speak with you today.
Well, it's one thing reading something on a social post or as you're browsing through the news or reading a newspaper, but it's another thing to hear the cutting edge information from one of the people who is their life's work is around this area. So we really are very grateful that you're with us today. Now, I always love to know how my guests come to be leaders in their area. So I'm going to ask you that before we get into the meat or the heart of the episode. So sorry about that pun. I had to throw it in. But I'd just love to know a bit more about how you got into this area, because you've dedicated your career to women's heart health specifically. What was that moment that you realised this was where you needed to focus your energy?
Yeah. Look, I'm a nurse. I'm from a family of nurses. I have always worked in cardiology. It was especially a specialty that I was particularly interested and drawn to. So I've worked in this area as a clinician. I've also taught in the university and also been a researcher. And look, I've got a mother who's a bit of a feminist, so, it probably wasn't rocket science that I was going to go into this, but my focus and passion, as you mentioned, has always been around women and heart disease. And, it's just not well known that we lose 20 women a day, and this is, one of the biggest killers of women. And you mentioned about the specific moment, and I can actually recall I was interviewing a woman for a study, and she was the one that actually challenged me. And she said, Linda, it's wonderful you're doing this research, but how did I not know? Why did I think breast cancer was the biggest killer? How do we not know that this is affecting us in such a big way? And I thought, wow. And I thought about that for a few years because obviously she was right. And at the time when I set up the charity, because I really just decided I had to leave my role with a wonderful team. I was professor and managed more than one centre. But in 2015, there was 27 women's cancer charities, but not one dedicated to heart disease. So I thought, okay, somebody's got to do it, and it looks like it's me.
Well,
So
I'm glad it is
yeah.
you because you're doing such a lot in this area. So I'd love to start by hearing a little bit about that journey then, because what does you made that big decision moving from being a researcher into founding a non-for-profit, and that's a significant shift from that
Mm,
area of academia
mm,
to what you're doing now. So
yeah.
you talk about what drove the decision, but what does Her Heart actually do for women? So if you could just get into we'll
Yeah.
dive into a bit more of it later on as well, but just what does Her Heart
Yeah.
do for women?
Well, I mean, it's Her Heart's sort of Australian only not-for-profit charity, whatever you want to call it, dedicated to women and heart disease. And I really wanted it to, serve the women that had spoken to me over the many years. So I came up with 4 pillars that we would support women, and it's across awareness, because we know there's a lack of awareness, education, and that's because I happen to have 2 education degrees, and I thought you can't educate people when they're not even aware of the issue. So awareness, education, research, having evidence, and having been previously a researcher, I knew how critical the evidence was, and also advocacy, supporting women to be an advocate themselves, but also us sort of advocating on behalf of women.
Mm-hmm.
So I think when you look at Her Heart, probably one of the things I'm most proud of is the fact that, it really speaks to women. It's designed to help them understand their risk, support those who do have heart disease as a risk factor, but also support those that have perhaps had a cardiac event,
Mm-hmm. Mm-hmm.
and support them through various ways in their journey, but also to take action. But one of the other things, Jo, was I soon realized, and I knew this from the research, that it was really important to work closely with health professionals. And
Yes.
I don't mean using some of the language. I mean, the medical misogyny can be a little bit difficult to hear from some of the health professionals. So I think, supporting health professionals in terms of resources. And we also offer an annual conference, because we know from the research that women are less likely to be diagnosed, they're underdiagnosed and undertreated. So
Mm-hmm.
it's really important we don't gather all this interest in women and then they're going to seek help and they're not getting help, because it's an awareness issue in health professionals as well.
So that really does highlight the importance of Her Heart and why it was created. So again, thank you for doing that. So when most women hear that word heart disease, though, they think of a heart attack. That's sort of the heart disease equals heart attack.
Yeah,
But it's more of an umbrella term. Can you just walk us through the
yeah.
various conditions that fall under the category and which ones perhaps are more relevant for women, if that's actually a case?
Yeah, look, you're quite right. Heart disease is an umbrella term, and in the medical term, they use cardiovascular disease. I mean, it can also, people sometimes say, oh, does that include stroke? And of course, there's a lot of the risk factors that do, sort of relate to stroke as well. But it's not just one condition. So it does include heart attack, as you mentioned. It includes coronary artery disease, so changes within the coronary artery. And some of these diseases specifically affect women, more than men. So
Mm-hmm.
that's what they call microvascular disease, which is when the heart spasms, but there isn't necessarily blockages. There's something called SCAD, which is abbreviated for sudden coronary artery dissection, where there's a tear in the coronary artery, and some of the younger women get that.
Yeah.
There's things like heart failure, and there's also heart rhythm problems. So, the heart is a pumping mechanism, so there can be problems with the pump, such as in heart failure, or there can be problems with the rhythm, and that's where we call arrhythmias. And atrial fibrillation is one example. And I know more women are getting atrial fibrillation, specifically sometimes midlife and thereafter.
Okay.
We can talk about that a little bit later. But the other thing is, they present differently to men, and not that men need to be the benchmark, but I'm just saying that
Yeah, sure.
that's why women are often under-recognized, and that's part of the challenge.
Gotcha. So what should women be looking for? Let's talk about that then, because I think this is where so many of us are, in the dark for whatever reason it might be, because we don't have that awareness. What are the broader signs and symptoms of heart disease in women? And then, how might that differ from men? Because you did explain that there are some that are more common in women.
So we know that most women will get some form of chest pain. So 60% get chest pain. But, what we've been used to seeing in the media and what's often been portrayed is that typical Hollywood heart attack, they call it, crushing central chest pain, pain down the left arm, the men are sweating. But, women do have pain, not all of them, as I said, 60%, but it's often a heaviness in the chest. Sometimes it can go up to the jaw. I remember some patients telling me when I was doing the research that they went to the dentist because they actually had jaw ache, and so it can go up to that, or it can go through to the back and shoulder blades. So that's the other thing women say. Well, it didn't really feel like a crushing central chest pain. It went through to the back though. I had pain in my shoulder blades. So I think if women are just aware that these are some of the symptoms, women also feel incredibly fatigued. They also can have shortness of breath, a lot of sweating. Some of them have said to me, oh, I really noticed it. I'd be walking up not a steep incline, and I'd suddenly think, oh, wow, I'm feeling a bit short of breath. I need to sit down. So I think these are a little bit more subtle. And I think women will just keep going until they really stop. So we know that. So it is easy to be dismissed by women themselves. But, I think it's something that does irritate me when they say, oh, well, women aren't reaching out, because we know women are reaching out. But the issue is that it's not only the women themselves, but the health professionals, that aren't picking up on these. And I think the lack of awareness around this issue and around the difference in symptoms is a problem, because women don't recognize it in themselves to go early enough. Usually it's been happening for quite a while before they then present to their GP or whatever.
So is there any reason why men and women present with these sorts of symptoms differently?
I mean, physiologically, there is differences. So we know that women have smaller arteries to men. That one of the standard procedures is a coronary, where they look at the coronary arteries, and they used to go through the groin for women, but now it's quite standard practice to go through the radius in the arm, of all things. But of course, women, and especially if you're a little bit more petite, it can be difficult to access. So there's physiological differences that, but even so, saying that, the issue is that there are definitely sex differences when you look at how women are diagnosed, how they're treated. So we know that women statistically get less angiograms than men. And statistically get less stents. So,
So should that be on par? Like that, should that be something that we should be looking at? Men and women's numbers for those sorts of procedures should be very similar.
Yes. And we've been working, I mean, this is sort of taken a little further, but we've been working with the National Cardiac Registry around that. And they came up with the fact that women actually took 20 minutes longer to get from, sort of the early signs to the cath lab. And that 20 minutes, we talk about time is muscle. And then we wonder why women are twice more likely to die in their first year. And it's because, they're not getting treatment early enough. They're not getting recognized early enough. And it's a trajectory problem. It's all the way along.
So that's a very significant consequence for women.
Yes, it is. It is, because the outcomes are significantly poorer for women.
how long has the medical fraternity known these sort of numbers that are affecting women? Is it something that is just not being promoted when?
No, no. I mean, when you think the systemic problems all the way along, to be honest, Joe. I mean, women weren't in all the research studies until 1990. So, of course, you've got underrepresentation. So when you look at, drugs that are tailored for women, all these other things, it's a problem because women are not represented. I think they're like 24, 25% in studies. Well, that's not good enough.
No.
And there has been some changes to that. I know the big peak bodies like the NHMRC, which is the Medical Research Council that funds research, has said there has to be parity. There has to be 50% of women that are included in studies. And that's where things will change. And also the MRFF, which is the Medical Research Future Fund, and they've come out and said that as well. So that then it has to be included in order to get the money in the research projects.
So are the numbers improving over time? Are you seeing an improvement, or is it just so slow it's at a standstill, or looks
it's slow because that initiative has only been implemented this year.
Oh, okay.
So in terms of if you're going to apply, you have to look at gender differences or sex differences, whatever the project is,
Yes.
in order to get that. And yes, but that 1990, I mean, it's staggering to think that women weren't represented. And, even when you look at some of the research that starts in rats and mice, they just didn't use the female rats and mice because, they had hormones and that was problematic. So, yeah.
Yeah, it must be a source of frustration, but it's wonderful that there are people who are leading the charge to try to advocate more for, for women's in research. So you talk about the importance of women knowing their numbers, and I love that framing. So can you explain what that means in practical terms and what tests that you recommend women have, particularly in midlife, to get a clear picture of their heart health?
Yeah, so I think it's all about knowing your baseline risk. So we start with things like if you've got a family history, and I often say, I've got a shocking family history, really, but I've always known this. So I've been able to take measures to prevent, a cardiac event. And then there's standard baseline things such as your blood pressure, knowing what your blood pressure is, your cholesterol, your blood sugar, weight. I mean, these are very simple, but they're really powerful indicators. And knowing them, gives you a starting point. But many women don't, think about this, and they don't think about other things that they are, doing, such as, smoking or vaping now. Unfortunately, there's a lot of younger women vaping. And it's really important that, you are assessed properly so that you don't just, think, oh, yes, I'll document them, and then you don't do anything about it. I mean, there is a government-funded heart health check, and, we are trying to get women to encourage to go and have their heart checked by a GP, because then you'll actually get your heart listened to. And, I give the example that when I was pregnant, it wasn't till I was actually pregnant that they found I had a heart murmur. And yet I had been and mentioned I'd got a family history, I'd had palpitations, but it was only when I was probably at risk carrying a child that they, better look into this. And I've got a valve problem, and my mum's got a valve problem. So, and I've managed to, work around that, but I knew fairly early. And these are the things that, along with somebody taking your blood pressure, asking you, where you might be up to at your life stage, such as midlife or, perimenopause or menopause, or if there's perimenopause in the family, things like that. It's really important that I think, you get checked out. And we do have a checklist on our website It's called the Her Heart Checklist,
Hold on.
and it just allows you to take it to your GP. It makes you think about the questions as well, rather than you sitting there and they're going, well, is there diabetes in the family? And you think, oh, actually, I think Aunt so-and-so might have been. So sometimes you can actually think about all of those things before you go, and then you can be prepared, I guess.
Yes. Well, what we're talking about the GP, and that there's the fact that you can download something and work through that. What are some of those key questions that women should be asking their GPs when it comes to heart health? And then if she goes to her doctor with some symptoms and feels dismissed, what would you advise her to do?
Yeah, if you've already downloaded the checklist, it gives you those sort of points, about understanding your risk. If I just take a step back, we actually have something as part of our membership, which is a heart age calculator for women. And it just, because women have often said to me, and I really listen to women. I think that's one of the things I'm most proud of. And they said, well, we don't know what questions to ask when we go to the GP. I said, okay, great, we'll create a checklist. And then another thing was, well, how do we know if we're at risk? So there's a lot of these online risk assessments that you can do, and they're called heart age calculators.
Mm-hmm.
So what they do is they would give you an assessment of your risk through, if you've got a family history, have you had, has something been picked up during pregnancy? Are you in midlife? And we created one specifically for women.
Huh.
And we've actually got that as part of our membership. But that's another thing that if you're not sure, because I don't know, I mean, women are time poor. They usually say that, but they also say, oh, I don't want to waste time with a GP if I'm not at risk and I really don't need to.
Don't want to be a bother to anybody. Yeah.
Yes, I know. And that's what women do have to get
Yes.
over it, because, unfortunately, I've been on the other end speaking to families when they've lost, their mother, sister, daughter, whatever.
Yeah.
So I think if you can get yourself prepared with all of those additional information about your risk, about times in your life. So we also know that pregnancy is a very important point in a woman's life. That's because if you have high blood pressure or hypertension during pregnancy, or you take that glucose challenge test, which is disgusting, where you've got to drink a litre of this drink, and your blood sugar is high, you actually have an increased risk in diabetes later on. And even if it's only marginally, your body is clearly under stress, because we say pregnancy is a stress test for the heart. It's a really good way to show that there's real issues, because your blood volume doubles during pregnancy. So I think it's really important that women, are aware of those things, and they might say, oh yeah, I actually had high blood pressure when I was pregnant, but nobody's followed up. Nobody is. So this is something that we're trying to get women aware of. And similarly with menopause, but I don't know if you want to ask that in a separate question or not.
Yes, I'll ask that in a separate question. Yeah.
Okay.
So what would happen then if, and you mentioned this earlier on in our conversation, that sometimes women are dismissed a little. What do you do? How do you advocate for yourself? What are some of the more empowering things from a professional like yourself? What would you suggest, having been on the other side and seeing both sides then, as well as women telling you that they've been dismissed? What would you suggest a woman does or says?
Yeah, I think it's important to realize, there's a lack of awareness issue across the board. So we know that even if a woman goes into the emergency department, she will sometimes get a lesser score than a man with a similar type symptoms. And that's because the health professionals are not aware. So there's sort of, I think, a lack of awareness across. And also, I don't know if you saw it, but there's this amazing show apparently in the US called The Pit. And they showed that this episode of where the senior medical person had challenged the ambulance people, the medics, the paramedics who'd gone to pick up a woman. And we know that women are less likely to receive CPR than men because people don't want to navigate their breasts. And in this episode, it actually highlighted that the paramedics had not put a standard lead 12 lead ECG because this woman was obviously probably quite well endowed and they didn't think about it, and he called them out. And he turned to all the staff and he said, oh, hands up, how many women would rather have, exposed breasts than actually die during the process? And it was a really good way to highlight this issue of differences. And, so not necessarily intentional, where people are dismissed. But I do understand there are times when women are wanting to get help. So, for example, one of our ambassadors and really great advocates, Deborah, went a number of times to her GP and to the emergency department and did not feel heard. It was only when she came back, she searched online and she came up with her heart, and then she went back and demanded to be seen, demanded that she saw a specialist. They did an angiogram and found a blockage of 80%. Didn't put a stent in, told her to wait. It was going to be done the following week. During that week, she had a heart attack. So, women do try to be heard and they don't feel empowered. And I think there's various ways you can do that. I mean, she obviously went back on the internet, and we know the women, are some of the biggest users of the internet because they like to gather all the information, gather all the knowledge, don't want to waste anybody's time, don't want to call, 000, whatever, to, take themselves to hospital. But, I often used to say, you literally don't want to die of embarrassment. Be embarrassed. It doesn't matter. If it's a false alarm, great. But I think, women are usually managing, well, what are they? The chief operating officers of their life as well as, and everybody else's life at the home, whether it's caring for, young children or older parents. We're more the sandwich generation than ever. I think that there's so many demands on women. So, I hope that answers some of them.
Yes, no, it does. Thank you. So what tests do you recommend women have then in midlife? So we talked about having our blood pressure done. What other sorts of tests can women have?
Yeah, well, it would be important to be assessed on what the issue is with women. So, for example, if, you've got a woman coming in during midlife, we know estrogen drops, you are more likely to get some arrhythmias sometimes. And if you're getting palpitations, then you're going to need a 12-lead ECG. But, it would vary on what the issue, but if you at the same time you're getting chest pain, then that's different again. So I think it's so important, sometimes we take on this thing where we medically diagnose ourselves, and it's not helpful. And it's not because you don't have the bigger picture. I always say, and I say this to my mother, who's 85, I say, stop self-diagnosing, tell the GP, because she will then take into consideration all of those other factors. So, yes, there's a whole array of tests. There's tests now that can look into and give you a calcium score to see what your deposits are. But I think sometimes it can be very overwhelming. I think women sometimes then will go in and say, well, I think I need this test, when they perhaps haven't taken into consideration all these other things. Like I know for women who are at increased risk, I mean, sometimes women don't even realize, but if they've had multiple miscarriages, that puts them at risk.
Does it?
So, yes, so there's lots of different things, Jo. And I think the thing I'd like to say is, please go and get a health check. And I know good friends of mine have said, oh, I went and they said, no, you don't need a health check, a heart health check, and they've had to insist. And I think sometimes that does take a little bit of courage, but
is
it's
there
important.
an optimal age for someone to have a heart health check then?
Well, I think it depends. I mean, if you've got a strong family history, I mean, in the case of this, well, I know multiple women, but I know Deborah, her brother had had a heart attack at 35, and she mentioned that. So, when you've got a strong family history like that, it is undeniable. And siblings and parents, if it's a distant aunt, it's not going to be the same. But it's incredibly important. If somebody in their 40s is getting, signs that they don't feel well, they feel fatigued, they're feeling short of breath, I would say get checked out. Don't think just because you're not 50 or 60, because it relates to those other factors. And if, yeah.
Yeah. Oh, that's great. Very good advice. So I hope anyone who's hearing some of these symptoms as they're listening to this episode and going, that's me. And if they haven't had a heart health check, this is the time to make that appointment. So you've spoken about the importance of looking at a woman's entire life course when it comes to heart health, and you've mentioned pregnancies, and then again miscarriages can be something to be aware of as well. So midlife, and because this is a podcast that is for midlife women, it's also a critical window. So can you unpack that for us, and specifically what happens to a woman's cardiovascular risk as she moves through perimenopause and then beyond as estrogen levels change permanently?
Yeah, so we know that, as you've mentioned, midlife is a transition point because estrogen, people don't perhaps understand, but estrogen is a protective factor for the heart. So of course, when you were losing that protective factor and it is declining, then cardiac risk actually increases. So this is why we often see changes emerge at this stage. And I think you can often find, and I know I did, that you actually become more sensitive to other things. So, for example, caffeine. Now, I've always had a sensitive, and I love coffee, but it doesn't love me, unfortunately, as much. And I can't drink after midday. Drink coffee. I know some people can, but I think if you are getting things like palpitations, which women can get because the hormones start, then perhaps think about the other things you're doing. And some people say, oh, but I don't drink coffee. And I'll say, oh, do you drink, caffeinated drinks like Coke? And they go, oh, well, yes. Oh, I couldn't get through without my Red Bull or whatever. And now, I mean, even talking about those things, they have like 25 times the amount of caffeine in. They are absolutely
rocket fuel.
not what is recommended. And people say, oh, but I only sip on it. But still, if you then say, well, that's equivalent to 15 cups of coffee, they go, oh my goodness. So
is that what it's worth? 15.
The amount of caffeine in those it is. We know now, and not just in women, but in men that are drinking them, that there's been more admissions to the emergency departments around a fast tachycardia arrhythmia because they've been drinking them. People are not aware of the amount of caffeine in them.
Oh my goodness. You think
so it's just those sorts of things. But I think it also alcohol, your resistance to be able to, it decreases quite a bit.
I don't at all now because of that.
Yeah. And honestly, I would say that, I mean, I gave myself a challenge last year, sort of a New Year's resolution, and I haven't drank since. So, I'm sort of 18 months, and I know I feel so much better for it. But I know it's not for everyone. I know there's sort of people who are a little bit precious about it, but I would just say really reduce.
So what causes the heart racing? Because that was me, and that was one of the biggest reasons why I declined, and to the point where I rarely have drinks now. You'd wake up at 3 o'clock, heart racing.
But I think it's a multifactorial because the thing is, women are also often increasing the number of things they're doing at that time in their life, you know, whether it's children, I don't want to say because it's not everybody's got children, but, you know, or whether it is parents or that they're, you know, the job that they're doing, there might be, you know, issues within a relationship, whether it's the spouse or whatever. So there's often a lot of other things happening. And we know that 3 a.m., that 4 a.m. wake-up call that your body's giving you is because the cortisol is too high. So it's actually waking you. You're not getting that deep sleep because that's when you should be getting your REM sleep.
Yeah.
And that's when you really do need to be thinking about your sleep hygiene at this time. I know that's a separate point, but I think, yeah, it's all hormonal. You've got a strong hormonal shift. It affects the heart rhythm. Women become more sensitive all around in terms of what they eat, what they drink. And obviously there's ways to deal with all of those things. And I've obviously been through it and certainly got a whole raft of things that I particularly did to, you know, just reassess and really prioritize your health. It's an opportunity. I know all these things are happening, and sometimes I have personally had a very dear friend, and she went through hell with hers. It was very hard. So it can be very challenging mentally as well for some people.
So you did mention that estrogen is like a protector for the heart, and with the declining levels, is there like a hormone replacement?
Yeah, I mean,
I know it's
it is a very difficult
hard.
topic
Yes.
because obviously there was that study which then was found not to be correct in terms of how it had been interpreted. But the thing is, it's almost a bit like, and you may not have heard this, but if you smoke and you're on the pill, you're 10 times more likely to have a heart attack. But of course, it depends, you know, if you've actually got a family history as well, if you've had, you know, so all of these things stack up your risk. And HRT and all the different things you can get now with patches and, you know, have to be carefully assessed because, you know, if you're in that bracket where your blood pressure is actually not great and hasn't been, and it's been high for a little while, there's going to be all of these other reasons why you're not going to be, you know, your GP might not recommend it. So that's why I say it's, you know, it's a bit like a patchwork quilt. You've got to sort of really have the sum of all of these things. You've got to think more broadly rather than just thinking, oh, you know, I can't deal with this. I need to have a fix. And that's what sometimes, you know, I know GPs will then take your blood levels to look over a period of time, you know, how it's tracking, you know, so there's just so many factors to include, but there's so many other ways that you can manage it that I think really do help with the long term.
Yep. And so while we're on this topic of perimenopause, so many women do experience heart palpitations during this stage and can find them quite frightening. So can you explain what is happening there and when should a woman be concerned?
Yeah. When you've, you know, got palpitations, it can be really very uncomfortable and very frightening for some people. I know a good friend of mine, she noticed it particularly when she was going through menopause with alcohol. And she then went to a GP. She had a 24-hour monitor put on, and they could see her going into episodes of atrial fibrillation. I think sometimes it's just good to sort of tell a story. And that her name's Sally, and she's spoken about this, and we've shared her story online. So this isn't anything I'm telling you. But, you know, she then realized, because was told by the cardiologist, she got referred to a cardiologist who said, look, you know, let's just see if we can see, you know, when it might be triggered. And alcohol triggered hers. So she stopped drinking alcohol. But of course, what they didn't want is her to continue in atrial fibrillation because it can throw off a clot. And the clot can go to the brain and you have a stroke, or it can go to the heart and you have a heart attack. So atrial fibrillation is important if, you know, for it to be diagnosed.
Yes.
And it is only one aspect of somebody getting heart palpitations. So please don't feel that, this, you might be, and you might, immediately going to have stroke. No, I'm not saying that. I'm just saying that it is important that it's checked out, that, and you would see somebody usually who's a heart rhythm specialist, electrophysiologist, they call them. And then there's various treatments. There can be treatments via medication, or they can actually do an ablation. And Sally talks about the fact that she had an ablation, which is a procedure where they stop the circling of the heart rhythm going round and round, because that's what atrial fibrillation is. It just sort of quivers.
Yeah.
And hers was successful, and it stopped it.
Okay. So what is the difference? And again, because we've got different terms, and because we're not,
No, I understand. Yeah.
What's the difference between heart racing, your heart's racing, and heart palpitations? Are they the same? Is
Okay.
language
Yeah.
change? Because
No, it is.
Okay.
So when your heart is racing, you're feeling like, you can take your pulse, or some people can feel it in their chest.
Okay.
And the palpitations is what the feeling is, but it's showing you your heart is racing. And that's just a simplistic, I mean, we would use the terms, you've got a bit of a tachycardia, which means your heart is going faster than it should be. And there's various types of tachycardia. So, but I think, for simplicity, you can, the palpitations comes from the feeling that if you feel on your pulse, it's often very steady, unless you're anxious, in which case it speeds up. And in atrial fibrillation, it actually is not a consistent pulse rate. So it doesn't, pulse at the same. It actually it'll go a couple, then it'll go. So there's an infrequency to it. And it's called a chaotic rhythm. And that's why we have to treat it
further. Yep. So you share that 80% of premature heart disease is actually preventable. Now that's both sobering, but it's also empowering. And I've had Professor Cassandra Zerke on the podcast before, talking about what we can do, lifestyle changes, what we can actually control, because genetics we can't control, but we can switch things on, off, and the volume button up on what we can do in our day-to-day. What do you see are the most important preventative lifestyle factors and actions that women can take to make meaningful changes and reduction in their risk?
And like you said, there are so many things that you can do. So I would say the first thing is, if you smoke or vape, you stop. We know that, there's even some cardiologists now who will not continue to treat you because obviously they're giving you medication to open the arteries, and the smoking and vaping just constrict them.
Wow.
So it works against the medication.
Yep.
And it deprives you of oxygen. I think the next thing is this new mantra, sitting is the new smoking, where we need to move more. We all need to move more. And, we don't need to be running a marathon, because I think we all do that literally and figuratively in our lives. We're all so busy. But I'm really mindful of this, and I guess sometimes it's helpful to hear, I will not sit for longer. Even at an hour's meeting, we will get up and have 10 minutes where we stretch. I walk every day or do some form of activity. So I do Pilates or yoga 3 times a week, and then I will do other things in between. But I think it's about finding something you enjoy. I know when I actually moved interstate and I needed to, find another place to exercise, and I'm not a gym junkie, it just did not interest me. So I think it's really important to find something, and a lot of people love dancing, do Zumba. I mean, it gets you moving, so I think, the smoking, the move more, and then I think this thing where, you are what you eat. Really think about nutrition. It's not just about calories. You know, you're obviously going to have a shift of your midlife with your body weight. You know, try to be kind to yourself. I mean, having a Mediterranean diet, you know, eating more fish, whatever that might look like for you. You know, sardines in particular are really good because they've got a lot of vitamin B12. I would say think about good fats like avocado. We know that women in particular need extra vitamin D. You can get all the vitamin D you need from 4 almonds. So, you know, just have a few nuts. You don't have to eat the whole bag. Just have a few nuts every day. We also know kiwi fruit are particularly good. So when you're under a lot of stress and your body's stressed, having a kiwi fruit gives you all the vitamin C you need. So I think there's, you know, short sort of things to eating well. We mentioned sleep previously. You know, being a nurse, shift work ruins your sleep. I then had 2 kids that didn't sleep. So, you know, I honestly, I've not been a very good sleeper. But I do things now and I really value good sleep. I don't eat late because we know, you know, it really is important to have that window where you can digest. I make sure I switch off all my devices. I mean, I know people talk about the blue light, but at least an hour before bed. I mean, I've never had a TV in my bedroom, but I know people do that. Think about the things that will help you get to sleep, like reading a hardback book, because the reading goes from left to right. It helps you go to sleep. The problem with scrolling from up and down is the opposite. That's why it keeps you awake. So I think stress management, you mentioned, you know, I meditate twice a day. I've meditated for 15 years.
I meditate twice a day as well. Are you a particular type of meditator? Are you a TM or a Vedic meditator? What's your...
a very simple one. I just pick an app that I like.
And
I've used various ones in the past. At the moment, I'm using Calm. I think it's fabulous. It's got some amazing vibrational music, which I use for reducing stress. And also it works at night. So I don't necessarily have to listen to somebody talking because I get interested. So if it's just music, it just helps you reset. So I think that meditation, the drink we mentioned, you know, it's 18 months since I stopped. It wasn't serving me. I know that's not for everyone. Don't have any coffee after midday. I can drink tea okay. So I think it's not about perfection. It's about consistency. You know, small changes over time make that difference.
You're speaking my language. That's exactly what I talk about continually. That is, it's a small changes over time. And everything that we've gone through they're multiple decisions that we make throughout a day. And it's just becoming more mindful of those decisions that we're making, which is so important for women. So on the Heart Health website, I'd love you to talk a little more about the incredible website that you've got there and what women, and again, we'll talk about, I'll have all the links popped in the show notes as well. But just talk through, you gave us a little bit about a questionnaire. What else have you got on that website so people know all about it?
So we've got information about the different symptoms. We've got different resources in terms of fact sheets. So if anybody's going through menopause, you know, we've got information specifically around that. I think that, you know, it's not sort of, you know, heavily in depth. I think there's so many different groups that specifically look at menopause. It's really just to show the relationship that it's important to think about it in terms of cardiovascular disease risk. But I think that we have a small wallet card that shows you the differences. That's been very popular. We have a membership, as I mentioned. We've got an online community that you can join for free. We've got 2 steps of a membership, and we're looking, the week after next is Her Heart Week. So we're going to be giving out free memberships for that. So if you sign up, then, you know, we'll be letting you know about that initiative. So that means you would get free access to the heart age calculator. The checklist is downloadable now in terms of you wanting to be able to get that. Yeah, there's a lot. I mean, we also, as I mentioned to you, we've had various time points. So one of the other questions was, I put out some research saying that if you had a female GP or a female cardiologist, your outcomes were significantly better. And I was inundated with, oh, wow, where's all these female cardiologists that you keep talking about? So we created an online Find a Female Cardiologist, and it has been accessed 26,000 times.
Oh my goodness.
So it is a great tool, and we are about to expand it. Because not everybody can. So only 15% of cardiologists are women. 15%, yeah. And they're obviously, incredible women, but they trying to find them around Australia.
Yes.
So that's available to everybody, by state, but by topic. So atrial fibrillation, you'd probably come up, and if you're in Queensland, Dr. Karen Phillips, I mean, I know a lot of them. So you can access that as well. And there's a whole heap of other information, and that's www.herheart.org.
Fantastic. And a lot of the listeners, we've got majority of listeners Australian, New Zealand based, but there are also, thousands and thousands of listeners from all around the world who are listening. So apart from the information on the cardiologists, is the information that is on the website that's standard information for all women,
Yes.
no matter where they're living?
Yeah. And
Fantastic.
to be honest, Jo, when I set up Her Heart, we were global within the first 6 months. We had 55,000, people sign up. It was incredible. So we have always been global. I think now we are in 128 countries. Yeah. So it's just so all of the and honestly, globally, women and heart disease is getting attention. Finally, it's getting the attention it deserves.
Yeah. What a credit to you, 128 countries.
Yeah, so and I think it's because it doesn't matter where you are, you're still getting that information or those resources, because we can see we've got a heart map, we've got a heat map on our website, and we can see where people are accessing, what they're looking at, where they're downloading. It doesn't matter. I mean, obviously, we would like to have things in different languages, for the heart health check, for example, in terms of the checklist, but we will get to that.
Oh, well done. Because I've had a look on the website, and it's a huge amount of information on there in all the different areas that you've talked about. So I really do encourage all women who are listening, get on that website, have a look, and find out what is going to be helpful to you. So that's globally. I just would love to talk for our Australian listeners. You recently attended the first meeting of the Ministerial Expert Advisory Panel on Women's Cardiovascular Health. That is a mouthful. And that sounds like a significant moment. So can you tell us more about what that panel is doing, what you hope it's going to achieve? And then we'll talk about that. And then I've got another aside for global listeners. Are there similar initiatives happening in the world that would give you cause for optimism? So it's kind of a two-pronged question.
Yeah. Okay. So it's wonderful that we're now getting greater awareness around women and heart disease, not only in Australia, but globally. And as I mentioned, we were in 55 countries within the first 6 months. The Australian has this national initiative, which is, and I'm on this ministerial advisory panel. So that brings together experts and consumers as well. We've got strong consumer representation to advise government on different initiatives, because the aim is to improve awareness, diagnosis and care, but we know it's important to recognise the gaps at a system level, and those are the things that it's really exciting to be able to look at those, because we need to be able to say where women can go and get assessed, what is available out there, like where are all these women cardiologists? And if not, I mean, when you look at the size of Australia, Central Australia, well, we know that there's amazing male cardiologists looking at women's health and have done for years. So it's important that we really get awareness of this. Yeah.
Yes. So when should the outcomes from all of the things that you're doing now, is there a timeline that you're looking to
Yeah,
work
so
towards?
it's actually they've changed it slightly, and it's for the year. So there definitely will be outcomes and deliverables, but there's important strategic things happening to be able to gather that information, like round tables and all these sorts of things. Yeah.
Fantastic. Well, that is exciting.
Yeah, no, it is exciting. And I know in the UK, there's also a really great initiative at the moment called Beating the Bias. It's a James Lind research initiative looking at research priorities for women's cardiovascular health. We have something similar happening over here. Professor Rochelle Wynne is sort of leading that initiative. So yeah, I think there's some really great things globally happening.
Fantastic. Well, that's good. And is there a lot of sharing of information in between professionals in various countries?
Yes, yes. I mean, obviously, it's in many ways quite a small community. There's been people toiling away for many, many years around women and heart disease, and obviously they feel like it's their moment at the moment. So that's great. But yes, mainly because a lot of the researchers, I mean, they have a passion for something. It isn't always recognized. So when it, I think, finally is, it's very exciting. Yeah.
Oh, that's wonderful. Good to hear. And thank goodness for women. And we, in this age, like we're so lucky, aren't we? I think of my mother and the women who are of her age and older, how they missed out on so much. So we are the benefactors of that, which is wonderful. As we're starting to wrap up, I just want to know, is there one thing, just one, that you would love every woman who's listening to this conversation to take away today? What would that be?
I think that, while there's 1 in 3 women that will suffer from heart disease, it is 80% preventable. And I don't know what it is about the heart, but it does put fear into people. So I'd say don't be afraid. Don't underestimate your risk, because knowing it and acting early can really change the outcomes.
Okay, that's an important one. And I always have to ask this because we are, after all, a podcast about redefining midlife. What are you genuinely enjoying about this stage of your life?
I think I feel very blessed to be doing something I love every day, and also making a difference to women's lives, not just in Australia, but globally. I know this from the countless messages that, I get from women from everywhere. So I think being able to focus on truly what matters is a real gift.
Yes.
And yeah, I think that this was really my calling.
What an incredible legacy. And that'll bring me up beautifully for this question. It's one of my favorites. What do you hope 80-year-old Linda is going to say about current day Linda?
Okay, I think that I led a life of purpose. I stayed true to what mattered to me. I've taken risks, and I didn't always know whether things will work out. I mean, I was a professor in a research center, all of that support, and I just resigned one day, and I had nothing, no money, no idea really what I was doing. But anyway, I did it anyway. So I think, when I'm 80 and looking back, I think I will say, that I created something meaningful, but more importantly, it made a difference to women's lives.
Oh, well, I think 80-year-old Linda is going to be very proud. And I'm sure your 83-year-old mother must be absolutely beside herself with pride.
Thank you. No, thank you. That's very kind.
Linda, again, we'll say herheart.org is where anybody who's listening can find that website, and they can get involved as little or as much as they would like there, because there are memberships available. So I'll make sure that all of your links are in the show notes for everybody. And on behalf of all the listeners, thank you so much for joining us today, because this could be an incredible opening for somebody to have their heart checked and change their future. So thank you for joining us today.
Thank you. My pleasure. Thanks, John.
Thanks so much for listening. If you enjoyed today's episode, please rate, follow, and share it with another incredible midlife woman. And join me next week as we keep creating an amazing second half of life.